Let's start with Niall Dickson, who's Chief Executive of the NHS Confederation, co-chair of the Brexit Health Alliance. Tell me what the Brexit Health Alliance, in a couple of sentences, what it's set up to do, Mr. Dickson. Good morning.
Good morning. Yes, it brings together industry, research, the NHS, everybody who's concerned with healthcare about trying to get the best possible deal in these negotiations for UK patients and indeed European patients. So we're an alliance of organisations, including industry and the NHS.
Right. Okay. How did you and your colleagues then respond to what you heard from the Chief Executive yesterday?
Well, we were aware that the NHS, both locally and nationally, needs to have proper contingency planning. The government has been saying a no deal is very unlikely, but it's not ruling it out. It's therefore vital that the NHS has plans at local and national level to do that. And there are obvious and immediate short-term issues that you've touched on, such as the immediate supplies issue, that need to be tackled. And we need to do that now so that in March, if the worst happened, we did not have a situation where we couldn't access the medicines and the devices or anything else that we needed, which might be needed the following day. You're not talking about stuff going on for a long period of time. Yeah. Even delays by a day or two could be absolutely vital, because the NHS, like an awful lot of other industries, increasingly works on a just-in-time basis. So the products that, for example, will be used in operations later this week may well be arriving today. Indeed, the operations for tomorrow may be arriving today. So if those products don't arrive, those operations could have to be cancelled. So those kind of immediate issues need to be thought through. If that supply chain is interrupted or slowed down, what have we got in place in terms of whether it's warehousing or alternative forms of supply that will ensure that we continue to carry out those operations and those interventions and those treatments.
Not sure whether you heard the numbers I quoted, but if you look at the amount of medicines travelling either way, 37 million medicine packs arrive in Britain from the rest of the EU each month, 45 go the other way. There is a sort of quid pro quo here, isn't there?
Yes, there is, and it is something we've been working very hard with European organisations to say. It is not to say, and it would be foolish to say, that somehow Europe can't survive without Britain. That's nonsense. But the UK is a leader in a number of areas. The first is obviously the life sciences that Simon Stevens mentioned. That we are one of, if not the leading country in terms of the development of new products and so forth. We're involved in 1,500 clinical trials across Europe. We're leading on at the moment. Half of those will still be running at the time of Brexit as it currently stands in March 2019. So the interdependency of the whole system affects European patients as well as it affects UK patients, and that's something I think that is recognised by European organisations, but also we want it recognised by the European Commission, as we hope it is also by the British government.
In a sentence, Mr. Dickson, how nervous should people be about the NHS and a hard Brexit?
Well, I think people in my position and more exalted ones like Simon Stevens need on the one hand to be very cautious and to try and encourage very detailed planning going ahead. On the other hand, I think there is a danger you cause people to panic or indeed to try and store up things that don't need to be stored up, and you actually affect the supply chains going forward. So I think I remain of the view, which is the government's view, which is this is very unlikely. It is in absolutely nobody's interest for us just to crash out and try and work out the following day what it is that you're going to do. But I think you have to plan for the worst, but hopefully we're expecting something considerably better than that.
All right, thank you for your time. Niall Dickson, your Chief Executive of the NHS Confederation, you co-chair the Brexit Health Alliance. Listening to Rachel Clark, who is in the NHS as a